everyone. Welcome to another webisode on wellness, where we bring you expert health advice. Today, I'm in the company of Dr. Yoel Smith, and our topic of conversation is heart attack. Welcome to the program, Doctor.
Thank you for inviting me. It's an honor to be with you.
Great to have you. So, just as a starting point, would you like to introduce yourself to our audience?
For approximately 27 years throughout the U.S., I was a professor at 4 universities, including in Israel. I am triple board certified in anesthesia in the U.S., Israel, and in this integrated functional and personalized medicine. Did an advanced fellowship, did extra training in cardiovascular medicine. And most of the time in the operating room, I dealt with a lot of patients that had to have either scheduled bypass surgery or emergent, where patients came in through the emergency room and went to the cath lab for stenting, and because of the anatomy, they couldn't be stented, so they would call us and we'd take them to the OR for bypass.
So the topic of conversation today is heart attacks. Now, the common belief is that a heart attack is basically when your heart stops. Is that true?
No, a heart attack is when there's insufficient blood flow through the blood vessels supplying the heart. In current thinking, we believe that we know what causes a heart attack, and it's a plaque in the blood vessel, like a pimple in the blood vessel in the heart, blood vessel supplying the heart muscle with oxygen and nutrients. It's like a blister that ruptures, and pus, it's not pus, it's actually unstable lipids that break free into the blood vessel. And your body sees this as bleeding, and it sends in blood cells and platelets to clot, and fibrinogen to clot off the bleeding. That's how you have a heart attack. So anyone can suffer from this, and it is silent. You could be just walking along or driving your car and clutch your chest, and if it's in a major blood vessel supplying that heart, you can either have a massive heart attack or you will die from it immediately.
Is there a cause? Is there a particular cause?
We believe now that it's from, a lot has to do with genetics, and we can test patients now, their genes, because genes skip a generation. So you can have what we call a genetic SNP, an abnormal gene that does not function properly, that you got from your parents or grandparents. And because of this, you're more likely to have the genes to either not metabolize the lipids that you take in, or a plaque that ruptures. If you do not have the proper genes to metabolize these lipids or sugar, you are at risk.
And in terms of testing, if anybody wants to, as a prevention or just knowing about their physiology, you mentioned that some tests that are available that people can do.
So we at our center, and we're probably the leading one in the state of Florida, I have patients that come in, we check a full lipid profile. There's a lot of things that impact lipids. Your thyroid does. Cortisol levels do. If you're stressed, cortisol causes blood sugar to go up and affects lipids. So it's a whole myriad of things that we look at. But specifically for the heart, when they come in, we do called an NMR lipid panel, which does not look just at total cholesterol and triglycerides, but we want to look at the cellular level of lipids. Are the lipids, do you have too many particles, too many lipid particles? are these particles small and dense that can slip under and create plaque? And then there's two cutting edge tests. One is called Clearly. This test uses artificial intelligence to actually look in the coronary arteries and tells me how much plaque is in the coronary arteries. It tells me if there's stenotic lesions. In other words, if the blood flow to the heart is being blocked from plaque. Now, there's things that you can do. Chelation therapy, IV chelation therapy, which has been done for many, many years. What this does is eats up the plaque in the vessels, eats the calcium up so the blood vessels open up over time. So this testing is very, very cutting edge, and it's preventative. The other test is called Vibrant Cardia X. And that's a blood test we draw, and we send it out. And what it does is it looks at their genetics to see what genes are working, which genes work 50% of the time. In other words, you turn the light switch on, it works all the time. You turn it on and 50% of the time it works, and you turn the light switch on again and nothing goes on. So we can tell through those genes what they're at risk for and how to prevent it. So the patient then, when they get the results, it tells us how to mitigate or go around the gene to fix things.
My last question, Dr. Smith, is there a specific age that we should start worrying about getting a heart attack? And as a preventative measure, from what age should we start doing these tests and looking after ourselves and our heart?
Well, what I would tell you is if you have a family history, your father or grandfather died at a young age, 30s, 40s from heart disease, you're at risk. Things like your daily stress, your workload, what you eat, how much sleep that you get, quality sleep, these are really all very important. But I would say that if someone's father died at 35 from a heart attack and you're 30, you need to be checked. It's not a disease of the 70 and 80-year-old. It's now more common. And because of social media and the news and all these things, it's being brought out. Patients with dying from acute coronary syndrome. So rupture of the plaque, and they collapse and die. All this is preventative. And we can test all these things so that they have great longevity and quality of life.
Well, thank you very much for your time, and I appreciate the information that you've shared with our platform and with our audience. And if anybody wants to get in touch with the good doctor, how can they reach you?
We're in Florida. You can reach out to us. Our phone number is 321-421-7111. The website is antiagingim.com. The practice is Center for Anti-Aging, Aesthetic, and Rejuvenation Medicine. And you can check out our reviews on Google.
Thank you very much. Thanks for watching Wellness, where we bring you expert health advice.